I think, maybe some of that, I know you as a community health center, recruiter. I guess you do other recruitment. So, if there are other, people who I would run across, I would certainly, but I know your wheelhouse is largely on the medical side. But I think you've expressed, hey, we can get involved in anything you want to, but your wheelhouse is largely on the medical side. So, but is it community health center or is it hospital? Is it?
Sure. It's a good question. So probably 3/4 of our clients are rural or underserved in nature. And we define that as critical access hospitals, rural health clinics, FQHCs, and community mental health centers.
Cool.
Within that space, we can recruit any type of healthcare provider. That's both advanced practice provider and physician, regardless of specialty. And then obviously any C-level executive or senior leadership. When we start getting into mid-level management, it becomes a little dicey depending on the role. Is it nationally attractive? Is it something that warrants a premium service and fee like ours? Sometimes the question is more, does it make sense for us to come in when they can maybe find somebody with a little more effort, locally? And,
Sure.
and I will advise clients at times, make sure you've exhausted your own efforts before calling us, because, we're going to find somebody that's in your backyard you didn't know about. The rest of our business is traditional medicine, urban, metropolitan. We don't shy away from specialties that are difficult to recruit. I would tell you, yes, more of our positions are clinician based, but we work with a number of professionals and executives that, again, you mentioned that CFO search. We were primed and ready to take over that for you if need be.
Sure.
And I know that you were successful in making that hire. So I know that sounds like maybe we're not as niche as we are, but one of the things that I was trained on early on was getting to know the client and understanding what the client's needs are. And if you apply that same approach to philosophy, you can literally recruit for anything. And the things that you've talked about here over the last 45 minutes are universal to the recruitment process. If I decided in the future that I wanted to close this business or sell it or whatever, and just go do, financial recruitment across any industry vertical, I could absolutely be successful because the principles don't change, right? Now, obviously the network and the people you're reaching and where you're finding them is different, but beyond that, there's not a lot of differences. And it's really shocking to me that some of these more established firms out there are not more successful in, yeah, we can find you a CFO, but a chief medical officer, like, oh, that's impossible.
Yeah.
Well, the client, so why don't you just go find the right person for them?
Right.
And that also goes back to what I mentioned earlier, where, under a duress of search, they can't find something. They just give you whatever they can find. Maybe they know it's bad. Maybe they know it's whatever. But it's difficult to come to a client and say, I don't have anything for you, but please keep the faith, right? And I think, again, there's this a large part of the recruitment industry that just says, and I'm talking about the leaders of these firms that just say, hey, give the client activity, just show them that we're working, just give them anything. And that's just not really proper recruitment.
Right.
It's a different type of recruitment. And that's, again, something that we've tried to really separate ourselves from the pack, because there are even more activity-based firms out there. A lot of them use overseas labor or just heavy research, and they're literally just resume generators, if you will. They don't even know what a recruitment process or cycle should look like, but they know that, okay, well, this person's credentials say physician on them, so they must be a viable candidate. And you're like, that's 10% of what we need,
Oh, yeah.
They're a physician in psychiatry. Like, why are you even? So it's like anything else in life. There's a spectrum. And unfortunately, again, there's this, I guess, mass of recruiters that are just more shotgun approach rather than the precision and strategy you need to be effective. So
yeah, I think you need to give yourself a little bit more credit, because it is. I've seen all kinds of recruiters, and the intentional approach that you have is not common. So, and that's unfortunate, but it's kind of also a reflection of the service industry in general often. And I think that approach is what distinguishes you, seriously.